I call on Senator Blackburn.
Thank you so much. And thank you to each of you for being here. Ms. Mark, thank you for sharing your story. I appreciate hearing that. I know we're talking about Medicare Advantage, but Senator Blumenthal and I have been busy today introducing the Kids Online Safety Act. And Ms. Myrick, as I was listening to your testimony, I thought how closely it mirrors what I hear not only from moms and parents, but the teens themselves. I hear it from the psychiatrists and psychologists, from principals, that there is not enough access. And that there seems to be complete confusion when you call the insurance company and say, we're desperate for help. I have my child. We're here at the emergency room. We're not getting any answers. And it is just so imperative that we look holistically at this system. And I appreciated hearing from you on this issue. Dr. Resnick, let me come to you, because telehealth is something, even when I was in the House, and we were working on 21st century cures, and then I didn't get my telehealth bill in there, but we got it across the line during COVID. And during COVID, people really began to use telehealth. And what I hear from providers, especially down in Shelby County, Memphis, that area where you're dealing with Mississippi, Arkansas, and of course the Med is there in Memphis. And they talk a lot about interstate licensure requirements. So just very briefly, if you would talk to me a minute about what you are hearing from providers when it comes to that licensure issue, and also what you're hearing about the digital therapeutics and their utilization in these.
Thank you, Senator. My dad grew up in Clarksdale, Mississippi, so I know the Memphis area well, even though I'm now a Californian. And I'm always reluctant to use the term bright spot about anything in the pandemic, but telehealth, clearly opening up coverage, whether it's Medicare or commercial insurers, huge bright spot. Thank you for your leadership in that area. And we have seen not only patients learn how to use it well and discover when it's convenient, but we've seen physicians in every specialty, psychiatry included, learn how to integrate it seamlessly into a care plan, because sometimes patients need to be seen in person, and now we know more about when those instances are and when they're not. You mentioned licensure. We still believe in maintaining state licensure and that it exists in the place where the patient is. And the reason we believe in that is because if I'm taking care of a patient in Florida, I believe I have a responsibility to follow Florida's rules, and that patient needs to be able to go to their state insurance commissioner if I provide lousy care to seek redress. But we have some really cool stuff going on to aid in people being able to do telehealth in multiple states. We have the Interstate Medical Licensure Compact, where it makes it much easier for many physicians to just click off several states that they want to be licensed in and agree to follow those rules. We also, lastly, I'll just quickly say—
Is that the reciprocity model?
It's not pure reciprocity, but essentially it's not like the nursing reciprocity model, because individual states do still maintain the ability to police what happens in their states and take your license away. But it makes it much easier to get multiple licenses. The other thing is, we have seen the medical boards, the Federation of State Medical Boards, agree unanimously nationally, and now it has to be implemented on the states, on reasonable exceptions. If I'm taking care of a patient and they go off to college and they happen to be out of state, or they're vacationing or spend 3 months a year in Arizona, that's not really practicing across state lines. I have an established relationship. If a patient needs to go to a center of excellence and wants to do one pre-visit via telehealth across state lines, that should be okay. But we do want to protect patients and make sure they have local care.
You want to weigh in on this? Either of you, go ahead.
Telehealth has been transformative.
Okay, you were nodding your head, and I thought you might want to have a little something to say.
And the continuing availability, particularly in rural areas, is extraordinarily valuable. But also even in urban areas, where it may take people 2 hours to take 3 buses to get to us.
Okay.
So, and by the way, I trained at the Elvis Presley Memorial Trauma Center in Memphis. So,
God bless you. Ms. Gilberti, did you want, I saw you nodding your head.
I was just going to say that I'm very glad to hear about the college students, because we hear that all the time about college students that have a provider and then they lose access to it. And I think that, really this idea really needs to be thought through, particularly for mental health, where, the issues in a state, I really don't understand why we can't get more reciprocity and more ability to go across state lines with mental health care, because it's very problematic.